Let's take a trip into Zimbabwe, where in the past few years there has been a rapid rise in mass migration, poverty, and unemployment. First, let's start with the basics. There is a population of 11,343,000 people, a life expectancy of 40 years, an infant mortality rate of 80 out of 1,000 live births, and a GDP of 26.5 billion US dollars. Starting in 2004, Zimbabwe saw a negative GDP growth, lowering by 13.6%. The administration initiated economic reforms to get the country back on track, but the famine in 2009 didn't help at all. With the famine, the GDP lowered again to a negative 14.1%. Now the country's GDP stands at 332.1 million US dollars with a GDP per capita of 200 US dollars. Based on the stats in 2008, the economy has an inflation rate of 14.9%. The inbounded money restraint is the primary reason for the country's hyperinflation. Money was printed by the Reserve Bank of Zimbabwe to fund the budget deficit. This caused hyperinflation. On top of this, hundreds of millions of dollars were drained from the economy due to the war with the Democratic Republic of Congo, which lasted from 1998 to 2002. The government isn't accepting help from other countries, leading to large-scale migrations, poverty, and unemployment. Because of Zimbabwe's suffering economy and high rate of unemployment, they lead to these stats. As of 2009, there is a labor force of 3.84 million, an unemployment rate of 80%, and external debt of about 5.821 billion. As for general basic needs, 82% of the population are using improved drinking water. 44% of the population are using improved sanitation facilities, and 62% is the average annual rate of inflation. The EU and the United States are providing food aid, but sadly that's not enough. Even though there are many organizations out there helping out many children in Zimbabwe and all over Africa, there's still room for you to help. UNICEF ensures the availability of safe and clean water, proper sanitation, and hygiene promotion to Zimbabwe's children and their families. They enhance life chances with low cost and effective medical care and nutrition. Campaigns such as the TAP Project kindly ask you to donate money to grant a child safe drinking water. Just $1 provides the child clean and safe drinking water for 40 days. Imagine what $20 can do. UNICEF also provides ways to volunteer and be a part of their campaigns, and also to give monthly. You can supply one child or more with endless supplies of water, nutrition, and education. World Vision is a Christian humanitarian organization that helps children, families, and communities reach their full potential by helping them fight the causes of poverty and injustice. You can sponsor a child with $1 a day, providing them with health care, education, and other basic needs for living a long and healthy life. Other organizations, such as the Water Project, give clean and healthy water to impoverished families that don't have access to it. According to the website, $50 gives a family clean water, and if you donate enough, you can purchase a well pump or fund an entire project. Zimbabwe is one of the many countries that are highly in need of help. You can do something. Every penny counts.